Hi, I'm Jo. I'm one of the nurses with North West Central at Malham House.
I'm Adrian McCluskey, Senior Planning Manager in the Estates Department at South Wing St Mary's House.
Okay, so we looked at the environment and we came up with 4 areas that we thought would be the most important when it came to our environment when we were considering smart working. Yours is the first one.
Okay, yep. First of all, we looked at how we use the current space. We don't have an accurate picture of the teams that are involved in this Agile project, or Moving Agile project. We've got coverage of Millfield House, but we don't have Malham House, Linden, North Wing, and these are some of them are quite new environments, particularly North Wing, and a lot of feedback over the last couple of days about how packed these places are. We saw from the presentation from Bill how we talk about being a person-centred organisation, yet we put people in offices with their faces against walls or behind hedgerows of monitors. And we also heard about people saying, you know, we've got the evidence from other space utilisation exercises that says we're only using our offices 25 to 30% of the time. We're only using interview rooms 40% of the time. But when I go try and get a room, there's nothing there. And for people in the multi-occupancy offices, I can never get a seat to sit in front of a PC and do work. So we need to really capture the base evidence for the areas that we haven't covered, because you guys need it so you can say, oh, Tuesday afternoons, that's empty. Friday mornings, that's empty. Or we're only using this so much percentage of the time. So one of my actions, we have identified the project leads, but clearly with my association with estates is to go back to the estates department on Monday and say we need to implement space utilisation exercises for these areas, so you have the information about how you use your spaces.
The second thing that we did was identifying other community venues other than the bases that we're working in, and we saw that the main function of these was seeing service users, to complete our admin, and also to meet with colleagues. And we looked at the various different places that might have space for us to do that. Places like libraries, GP surgeries, one-stop centres, other trust buildings that are around. And we actually got into sort of talking about, like myself, I live in the south, and for me to go to the south base to start working there would be effective time-wise, because I could go, miss the traffic, do a couple of hours, then go through to start on my journey. So we were looking at sort of changing everybody's view of what is ours and where we are meant to be. So we become a big community mental health team rather than 3 very separate places that we only use our own things. So that was one of the things that we looked at there. Also third sector buildings, council buildings, other trusts that might be able to help us, and other places that I'm sure we're already using, cafes, parks, going to other places where we meet our service users. We need to look, we identified the things that we need to look at is, you know, how would we book these rooms? How easy would it be for us to go there? Would we need to pay for them? How would we access them? Are there codes, or do we need fobs? You know, sort of practical things. And also what we could use those rooms for. So if we're using them to meet with service users for a one-to-one, it wouldn't necessarily matter if there wasn't Wi-Fi or we weren't able to, you know, connect. But, you know, access for disabled people, people in wheelchairs, things like that we need to think about. And we also wanted to ask the service users, where do you want to be seen? You know, where do you want us to come and see you? And we thought about one good way of measuring that would be when people come to us, to give them a simple questionnaire about what would make you the most comfortable, where could we see you, and that sort of thing.
I mean, obviously using a range of venues and in different places, environments to work, whether it be in a clinical fashion or in an administrative function, people need to be able to maximise their technology. And I'm aware there's lots of overlaps in the different projects. That's possibly because we're just hearing other people's projects for the first time. But one of the things that came clear in our group was, do we really know what we can do with our technology? Insofar as people were given the recent smartphones and the similar experience when people were given laptops, what training went into actually knowing what those could do, and how do we maximise that? A classic example this morning was one of the colleagues who's just got a phone didn't know that they had Microsoft Office on their phone. and yet, you know, that'll link in directly into what they could do on a mobile or an agile way or a smart way. So one of the things that we want to look at is what are the needs of staff to give them more confidence in using this technology in different environments. And that, we're bringing in our colleagues from IT to help us with that, maybe some of the IT colleagues shadowing how staff are using that technology to advise and then build up a list of things that we can train staff or develop staff in better use of modern technology.
And then the last thing that we looked at was, what do our bases need to look like, rather than just being a sea of desks? You know, how do we want to work, and how do other organisations use their space? We spoke about sort of uni libraries, the way that they have things set out, other trusts, storage for staff. You know, does everybody really need the generic 3 desks that we, you know, the drawers that we've always had? Can we use like really small lockers? Can we think about other ways? And then we thought about going to other places like Wakefield have got, you know, a new base that they're using. Go and see, sort of take photos of that sort of thing. Possibly go to Google in California. I'm up for that. Yeah, we'll go together. That's cool.
Everybody.
No, we'll tell you what it's like. So go and look how other people are doing these things, and you know, the ones that have been really successful, and what, you know, how many desks do we really need? Would it be better if we took some space and used it for something else? So really sort of focusing on other people that have already done it and done it quite successfully, and what can we copy, what can we pinch from them, to see what we could implement for us.
And can we get an all-inclusive hot desk model in terms of people working the same way rather than individual offices, etc.?
Yeah, we thought about planting the seed of hot desking, didn't we?
Yeah. For everyone.
For everybody, so it's equal. And that was as far as we got, really.
Well, you go to other organisations, every level of the organisation, there's no offices. But there are key functions that people need to do, and I know because you raised it earlier in the 3 days, about you have to have a consistent approach to training, to supervision, to seeing service users, etc. That's about the function being there, or the facilities being there for you, but not a room that's set aside for one person that's there 30% of the time and never used the rest of the time. We need, it's a process of change, and it needs to be an evolution to get to a situation. People have to be comfortable with it. They have to know that I've got students, I've got a service user at this time, they're coming every Tuesday at 11 o'clock, I need a room, they're available. But it doesn't need to be an individual's room, it needs to be a facility that's available, that people can be assured, I've got that facility when I need it. Mm. It's the start of the process, Bob, but you know, what the photographs that Bill showed on Monday, or sorry, no, it was Wednesday. Oh, where'd that week go? Is reflective of how we work, particularly in areas like North Wing and Linden House, which is banks of monitors, people squeezed in, students sat on the knee practically, almost like a ventriloquist, all trying to look over to see. But does that just happen at peak periods? I mean, this comes back to the space utilisation. And then it's come back and asking, can we get rid of some monitors? Do we need all those monitors, especially if we've got laptops? Somebody referred to about having stand-up desks, where people go and stand up and do things. And we know that there's colleagues already within the trust doing that. In HR, wasn't it, Alison, you were saying you've got the stand-up desks. Yeah, and people prefer to do that. I mean, and I do talk about it. I mean, I heard reference last year about sitting down being the new smoking. So it's in terms of what it can do to you. So it's looking at the range, but it's asking people how they do, but also presenting evidence.
Thank you very much. Right, well.